Did you know that most strokes happen silently, without the dramatic warning signs we often associate with them? Shockingly, a staggering number of people experience silent strokes, showing no obvious symptoms. Despite being one of the leading causes of death in the United States, affecting over 795,000 people annually, strokes or cerebrovascular events can happen without a prior warning. This is a critical issue, as about 87% of strokes result from blocked arteries, cutting off vital blood flow to the brain. Delaying treatment can have devastating consequences, as oxygen-deprived brain tissue quickly starts to die and can cause permanent damage to the affected part of the brain. But there's hope. By recognizing the often subtle signs of a silent stroke, you can take immediate action and potentially save your life or protect yourself from possible damage. In this video, let's learn about some subtle stroke signs you should never ignore. Let's begin. Number 1. Incontinence. Incontinence in bladder or bowel movements can affect anyone, but it is more prevalent in older people, pregnant women, and individuals who have underlying health conditions. Research studies suggest that incontinence can be an early sign of stroke. The connection between these conditions is due to the damage that a stroke can cause to the brain, which can impact bladder and bowel control. When a person suffers a stroke, the brain signals to the bladder and bowel may become disrupted, leading to urinary or bowel incontinence. It can manifest in different ways. For example, some individuals may notice frequent urination, while others may experience sudden urges to urinate or have sudden bowel movements. So if you notice that you are unable to hold your urine or feces, this might indicate a risk of an upcoming stroke or other underlying health issues. Number 2. Nausea or vomiting. Most people associate strokes with physical symptoms such as paralysis, numbness, and slurred speech. However, research shows that some people experience nausea and vomiting as initial stroke symptoms. Nausea is basically a feeling of sickness in the stomach and the urge to vomit. Vomiting occurs when the contents of the stomach are forcefully expelled through the mouth. Research shows that nausea and vomiting-related strokes are often associated with high blood pressure, diabetes, and abnormal heart functions. Migraines and strokes can both present with similar symptoms, including nausea and vomiting, making it challenging to differentiate between the two. While not all strokes involve headaches, some types like hemorrhagic strokes can present with severe headaches similar to migraines. Aura, a common migraine symptom, can involve temporary visual disturbances like flashing lights or blind spots, while some strokes can also affect vision. But there's a difference. Strokes often have a sudden onset, whereas migraines typically develop gradually over minutes or hours. Migraines usually resolve within 4 to 72 hours, while stroke symptoms can persist or worsen rapidly. According to a study conducted by researchers at the University of Alabama, nearly 30% of patients with silent strokes exhibit dizziness, nausea, or vomiting as their prominent symptoms, often leading to their stroke being overlooked or misdiagnosed. So it may be hard to tell if that's a migraine or a silent stroke. But if you are having unusual and sudden headaches in addition to other symptoms that you'll learn in this video, it's essential to get immediate medical attention. Number 3. Loss of vision. When a stroke happens, it disrupts the way our brain works, affecting our sight, touch, and even thinking abilities. Losing vision, even for a short time, in one or both eyes can be a sign of a stroke. However, many people ignore this important warning sign, thinking it's just tiredness, eye strain, or a rough day. But ignoring a silent stroke can be dangerous. It can lead to lasting brain damage, and sometimes even death. A stroke may also be signaling you about other health problems you might not know about, like high blood pressure or diabetes. These conditions can damage the tiny blood vessels in your eyes, slowly making your vision worse and increasing the risk of future strokes. Early diagnosis and treatment of silent strokes and the health problems they're linked to can protect your vision, brain function, and overall health, and even stop future strokes from happening. Number 4. Sudden drowsiness. Drowsiness is a normal feeling you might experience when you're tired, overworked, or sleep-deprived. But drowsiness caused by a stroke is different. It can show up suddenly, without any obvious reason, and stick around for a long time. This can happen when the brain is internally injured and wants to save energy for healing. With stroke drowsiness, people may feel sleepy all the time, even during ordinary activities like talking or watching TV. In some cases, they may even fall asleep suddenly and find it hard to wake up. This sudden sleepiness is usually a sign of brain damage from a stroke. Remember that drowsiness isn't always due to a stroke. If you're feeling tired or drowsy, consider your sleep habits and daily activities before jumping to conclusions. But sudden, unexplained drowsiness, especially with difficulty waking up, is a serious warning sign. So, if you or someone you know experiences this type of drowsiness, it's crucial to seek immediate medical attention. Number 5. Seizures. Many people think seizures are only caused by epilepsy, but that's not always true. Several medical conditions can trigger seizures, including strokes. Strokes disrupt normal brain function, which can sometimes lead to seizure-like symptoms. Look for other signs like weakness on one side of the body, like if it's hard to move one arm or leg normally, or slurred speech, in which the person might mumble, speak with difficulty, or struggle to find words, or loss of coordination, in which they might stumble, bump into things, or have trouble holding objects. So if you see seizure-like symptoms with these additional signs, call emergency services or get the person to the hospital immediately. Early stroke treatment can minimize damage and improve recovery. Number 6. Hiccups. We all know the annoying tickle of hiccups, but what if they could be a sign of something more serious? Recent research suggests that in some cases, prolonged hiccups could be a rare warning sign of an impending stroke. Strokes disrupt blood flow to the brain, and while they mostly affect movement and speech, they can also impact the brainstem, the area controlling breathing and hiccups. This disruption can lead to hiccups that just won't quit. It's crucial to remember that hiccups alone are not a definitive sign of a stroke. They can be caused by many other factors like eating too quickly, emotional stress, or certain medications. However, if you experience persistent hiccups lasting over 48 hours without any other explanation, especially if you have risk factors for stroke, seeking medical attention is always a good idea. Number 7. Pain. Strokes, sudden blockages, or ruptures in brain blood vessels often strike silently. But before they deliver their full blow, there can be subtle clues, and pain can be one of them. Studies suggest that up to 40% of stroke patients experience pain, often before other, more recognizable symptoms. This pain can manifest in unexpected locations, acting as a cryptic signal from your brain in distress. For instance, chest pain that radiates to the left arm and neck can be a sign of a myocardial infarction or heart attack. Similarly, pain that travels to the jaw or teeth and causes headaches may indicate a problem with the temporomandibular joint, or TMJ for short. Back pain, on the other hand, can be a symptom of lumbar spine issues, spinal cord problems, or kidney stones. Number 8. Fainting. Fainting alone doesn't necessarily mean a stroke. Dehydration, low blood pressure, standing up too quickly, and even emotional stress can trigger it. But if you haven't experienced fainting before, or if it happens abruptly without a clear trigger, it indicates something more serious and needs immediate medical attention. Plus, if fainting happens with other potential signs of strokes, like difficulty speaking, numbness or weakness on one side of the body, vision problems, sudden severe headache, and dizziness, consult a medical professional for proper diagnosis and treatment. Remember the acronym FAST for quickly identifying and remembering the most common symptoms of stroke. F stands for facial drooping. Look for unevenness or drooping on one side of the face, especially around the mouth or eye. Ask the person to smile to make it more apparent. A stands for arm weakness. Check if the person can raise both arms straight up and hold them there for a few seconds. Look for any weakness or inability to do so on one side. S stands for speech difficulty. Listen for slurred speech, difficulty finding words, or forming sentences clearly. Ask the person to repeat a simple phrase like, "The sky is blue." And T stands for time to call emergency services. If you notice any of these symptoms, don't delay. Call emergency services or get the person to the nearest hospital immediately. Every minute counts, and early diagnosis and treatment of stroke are crucial for minimizing damage and improving recovery. Make sure to like this video and subscribe to the channel to support our mission to help improve your health. Thanks for watching and see you in the next video.